Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. My name is Nabilah. I come from Department of Internal Medicine, Faculty of Medicine, Dr. Sutomo Teaching Hospital, Universitas Airlangga, Surabaya, Indonesia. Let me present to you our paper about clinical characteristics of 6,102 asymptomatic and mild cases patient with COVID-19 in Indonesia. Coronavirus disease is a global public health issue that has been confirmed as a pandemic in March 2020. As further study of COVID-19 and its characteristics evolve, there are many unknowns about patient epidemiology, such as length of hospitalization and recovery-related outcomes that are critical to the readiness of the healthcare system. Most studies have researched clinically severe patients, and few have focused on clinical course in asymptomatic or mild patients with COVID-19 infection. This knowledge, taking into account reported infection and prediction models of undocumented or asymptomatic infection to guide further strategies to reduce transmission and better outcome. The aim of this study is to describe the clinical characteristics of asymptomatic and mild cases patient in one of the COVID-19 treatment centers in Indonesia. Here is the material and method. The research is descriptive study with study design retrospective cohort design from electronic medical record, time from May 2020 until February 2021 in Indrapura Forfront Hospital, Surabaya. All patients were laboratory confirmed to have SARS-CoV-2 infection. Specific real-time PCR SARS-CoV-2 results were positive that hospitalized in Indrapura Forfront Hospital, Surabaya with purposive sampling. The eligibility criteria, all patients with COVID-19 enrolled in this study were diagnosed according to the guidelines for diagnostic criteria of clinical management of COVID-19 interim guidance from World Health Organization. Mild case patient was made based on the criteria for symptomatic patient and met the COVID-19 case definition without evidence of viral pneumonia or hypoxia. Here is the result and discussion from table 1, demographic characteristic of the patient. Here is the demographic characteristic from the research period of May 2020 to February 2021, a total of 6,102 patients were found to fit the research criteria. Of these, 3,664 patients, or 60%, were male, and 2,438 patients were female, with the most common age range of study subjects being productive is 21 to 30 years old, followed by age of 31 to 40 years old. Demographic characteristics of 3,007 patients work as a private employee, followed by civil servant and as medical personnel with detail of 140 nurses, 75 doctors, and 36 midwives. In total, 4,626 patients without comorbid, being 75.8%, and 1,476 patients had comorbidities. With the most comorbidities were grade 1 obesity, being 1,958 patients, followed by hypertension, a total of 1,015 patients. And also a small number of patients have various comorbidities such as chronic kidney disease, bronchial asthma, and also HIV. From total of the COVID-19 patients that were treated at Indrapura Forfront Hospital, there were 2,486 patients, or 40.7 patients, without complaint, 3,329 patients with mild symptoms, and 191 patients with moderate symptoms. The most common symptom was coughing in 1,118 patients, followed by fever, anosmia, common cold, headache, nausea, shortness of breath, and diarrhea. There are also other symptoms complained by the patient, such as abdominal pain and also sleep disorder. All patients treated at Indrapura Forfront Hospital received symptomatic therapy, such as antitussive, and then expectorant, antipyretic, decongestant, bronchodilator, isolation, relaxation, nutrition, and observation. As of February 2021, patients received vitamin C, N-acetylcysteine, decongestant, paracetamol, and lorazepam for anxiety disorder. For comorbid hypertensive, 870 patients received amlodipine, and 129 patients got candesartan. Patients with comorbid diabetes were treated with metformin, glimepiride, and also insulin. Patients with desaturation, oxygen therapy as many as 158 patients. None of the patients at Indrapura Forfront Hospital received any antiviral therapy, antibiotic, or corticosteroid. We know that some of the antiviral that many studies have done, such as chloroquine, hydroxychloroquine, oseltamivir, lopinavir, ritonavir, favipiravir, and remdesivir in the management of COVID-19 based on a small-scale clinical studies, which is not enough strong conclusion about efficacy and safety. The use of antibiotics for prophylaxis in COVID-19 patients with mild symptoms is not recommended, can lead to wider bacterial resistance and also increased morbidity and mortality. The use of systemic corticosteroids based on WHO recommendation are only given to COVID-19 with severe symptoms. Immunoglobulin, convalescent plasma, interleukin-6 inhibitor, TNF-alpha inhibitor can be useful in certain patient population based on the severity of the disease. Here is the clinical outcome. Of a total of patients, 5,923 persons, or 76.1% will recover, and 36 patients continue self-quarantine. There were 142 patients referred to indication of desaturasi, and 1 patient who died with the cause of death of cardiovascular event. Based on the average length of stay, the largest number were in the group with less than 10, as many as 4,529 patients, and more than 10 days, as many as 871 patients. All patients were admitted in Indrapura Forfront Hospital with a positive real-time PCR SARS-CoV-2 swab result. After the patient is discharged from the hospital, they provide feedback regarding the post-treatment swab examination. Of this, there were 5,003 patients who performed the examination swab, with the result of 3,124 patients were found with positive results, and 1,879 patients negative. Investigation of exposure history is primary screening method for asymptomatic patients, especially for adolescents, women, and people without comorbidities who are more likely to be asymptomatic when infected. Here is the conclusion. In asymptomatic COVID-19 patient, the therapy provides a supportive asymptomatic. Isolation and close observation are still considered better option for asymptomatic COVID-19 patients. But research evidence is very limited, and specific characteristics of asymptomatic infection need to be explained further. Thank you.